Gloves off. We're back again. My name is David Rice. I'm the chief editor here at DentistryIQ with
Katrina Sanders, the dental hygienist.
I love it, Katrina. So we are pulling the gloves off. We're talking about important topics that happen all day, every day in a dental practice to hygienists, dentists, assistants, patients. We know you're watching. And today we're going to talk about handling informed consent. Refusal.
Yeah.
What goes wrong? How do we do that?
Gosh. We could spend like 4 days on this topic because it's such an interesting topic. And I want to be very clear. We call it informed consent or informed refusal, because first and foremost, the patient actually needs to be informed, right? So I want to begin by saying, if a patient sits down and they're already going, I'm not doing that periodontal cleaning thing, are they really informed? I mean, are they truly informed? Because we look at massive studies of why patients decline their dental treatments. The vast majority of patients, the reasons why they decline their dental treatment plans is, number one, they don't trust us. Number two, they don't understand the treatment. Number three, they don't understand the consequences of not undergoing treatment. Those are the top three. Cost ranks fifth in the vast majority of these studies. So when we talk about informed refusal, informed consent, and informed refusal, the patient actually needs to be educated. They need to be informed. I do want to share a caveat. I think we need to put a line in the sand around who's considered a reasonable patient and who's just considered an unreasonable patient. And so this is, of course, a topic in and of itself. But if that patient is absolutely not interested whatsoever at all in the not elective, but the necessary procedures to treat the infection in their mouth, is that a patient you want in your practice? Is that a liability that you are interested in having in your practice? And, more specifically, is that $57 payment from a third-party payer for that pro fee worth it to you to put yourself, your license, your hygiene team's license, hygienist? I mean, does that feel good? Of course it doesn't. So we do need to think about, is this even a reasonable patient? And is it valuable to us to continue to bring that patient in, providing supervised neglect and substandard care? But I as a dentist, I guess my main question as a hygienist, I want to do excellent care, but the caveat, the challenge becomes a lot of dentists. I would imagine there's a lot of fear around, how do you dismiss a patient? How do you work through that? So as a dentist, what are your thoughts on when informed refusal comes up? What are your fears? What's going through your head?
So I love that. And I guess I would say 3 buckets. Hygienists, I love that you want the very best for your patient. Stick to your guns. So if you tuned in last time, we talked a lot about orienting each other, patients, dentists, hygienists. So you need to orient me. And, Katrina, you pointed out like motivators in life. So I'm motivated by the same things a patient is. And my data stacks up the same. So discovering what motivates me will help you treat your patients in the best light. But I couldn't agree more. We have to draw a line in the sand. We don't want to have a group of patients in our practice that we're supervising neglect on, and ultimately we're responsible when something goes sideways, right? No attorney in the right mind is going to say, oh, well, you said that would happen, right? That's even worse for us, because we've admitted something will go wrong and chosen to pretend it's not there. So I stand with you and hygienists. If you're with a dentist who maybe needs a little help, let us know. We can walk you through some steps on how to help you give your patients your best and how to dismiss that unreasonable patient.
Yeah, I agree. And I think that's an important piece. I think when we think about informed refusal, all of our heads immediately go to that extreme patient in the practice, right? Sure. Oh, Peter, oh, him, and when we're talking about true informed refusal, there's an entire population of patients that just don't understand or need a little bit more help in walking through the why.
Yes.
So I'll say this. I mentioned early on that statistic that the vast majority of the reason why the patient declines their treatment plan is because they don't trust us. They don't understand what the treatment is. They don't understand the consequences of not undergoing treatment. Cost ranks fifth. And the reason why I bring that up is because we oftentimes think that it's cost. We oftentimes think that it's an insurance thing. And so we try to downplay or treatment plan based on our perception of the patient's wallet or the patient's ability to pay. I do case studies all the time with my clients where I'll put up a patient, and it's a female patient and she just lost her job. And the question I'll ask is, so what did you all think when you read this case? And the first thing every dental professional thinks is she doesn't have insurance because she just lost her job. Instead of, she's a female, she's stressed out. In the case, she's got inflammatory conditions. Like, shouldn't we be more concerned about the fact that now she's stressed out and she's an inflammatory nightmare, a cardiovascular nightmare? I mean, this is our professional responsibility. So, a few things that I do share as far as informed refusal with my clients. The first thing that I want to be very clear about is an informed refusal form does not hold water in a court of law. For you to say to this patient, I'm sorry you don't want to have your x-rays today, or I'm so sorry that you don't want to do this periodontal treatment, even though your teeth are falling out of your head. Sign this piece of paper that, by the way, has been Xerox copied so many times in this practice that we immediately have a sheet available to you. I mean, what does that say to the patient, right? Sure, you really need this, but go ahead and sign this and I'll end up doing this anyways for you. So it shows that dental treatment is up for negotiation. That's what it teaches the patient. The reason why I bring this up is because I worked in a Medicare Medicaid practice for many years, where, in my opinion, that is a true patient population where finances actually are a challenge, where even though you can educate the patient to the best of your ability, you may still run into some challenges of them being able to afford treatment. And I had a deal with a doctor that I worked with at the time, the practice owner, where I said, I cannot do informed refusal. So I need you to trust me in how I'm going to approach these cases. And he said, yeah, I don't know. I must have a trustworthy face. I don't know. But he trusted me, and patients would try to refuse treatment, and I would continue to talk to them about it. And I didn't have a single patient sign an informed refusal form. And so finally one day he said, what are you doing that patients are accepting treatment? And I said, it's pretty simple. I talk to the patient about the treatment they need. The financial care coordinator comes in, gives them the fee. The patient tries to refuse, to which I will say, I understand that cost is a concern of yours. However, and I'm just talking about like periodontal treatment, for example. I understand that cost is a concern of yours. However, you still have this infection. And if I cannot be the one to treat this infection, somebody must treat it. So if you don't mind, I'd like to get you the phone number of a local dental or dental hygiene school so that you can receive this care. This care will be, discounted, or you might even get paid to be a patient there. But you need to receive this care. It is very important to me that you get this address, or it's very important to me that you get this series of x-rays. And only one time did a patient actually take me up on that and go to the dental hygiene school. Yeah. Which goes to show you that even in this population, that when you explain it to them and you help them, this is an infection in your mouth. This is the bacteria in your mouth. These are radiographs I need to take of your teeth. But I need to believe that the patient actually needs those things. If you're just taking bite wings on patients every 6 months because that's the protocol in your practice, and it has nothing to do with patient risk, Cambra, their perio risk, and you're just taking x-rays to take x-rays, the patient can read that. And then should they not trust us? So the idea being, for me, I think informed refusal gives us an opportunity to provide deliverables for our patient and why they should trust us.
I love that. Yeah. We teach people how to treat us. And when you set the expectation of this is what you need, it brings us more in that medical space. I've never gone to my physician and walked out thinking like, no, I'm just not going to do that.
Right.
I don't need all my fingers. I mean, maybe just 8 or 9 of them. So I love that. And, you drew a line in the sand. You let the patients know how important it is to you. And because it was that important to you, it became that important to them.
That's right.
We add one more little wrinkle to that in our practice. We call it, Shannon in our practice calls it the doctor card. So she'll literally pause, take a breath and say, you know what? I know Dr. Rice is going to want to talk to you about this. It's that important. And she just stops and stands there for like 10 seconds. And 99 out of 100 patients say, well, wait a second. You're going to go bring him in?
That's right.
I don't know if we need him in here. Let's go ahead and but you're right. We've got to believe in it. That was an amazing point. We have to believe in it enough. We have to make it important enough. We have to be willing to educate and not just go through the motions. And when patients see that in our eyes and they feel that in our words, that has absolutely been my experience for the last 27 years.
That's right.
Awesome.
Yeah.
Parting words.
Patients want to trust you. They do. So if you're starting to see these informed refusals, know that this is an opportunity to rebuild that trust.
I love it. Handling informed refusal. Gang, David Rice signing off with this one.
Katrina Sanders, the wine
I
genius.
love it. See you next time.